Today I want to speak about leadership in the emergency department. Not leadership as a title, not leadership as hierarchy, but leadership as behavior under pressure. Emergency leadership, commanding calm in chaos. The ED is emotional before it is clinical. The emergency department is not just a clinical environment, it is an emotional environment. Fear arrives before diagnosis. Pain speaks before investigations return. Uncertainty fills the room before clarity appears. A 67-year-old with crushing chest pain is frightened. A 4-year-old with breathing difficulty brings anxious parents. A 25-year-old after major trauma arrives surrounded by urgency and noise. Before we treat disease, we manage emotion. Leadership begins with regulating the atmosphere. Slide 4. Leadership is not a job title. Leadership is not a job title. The most senior person in the room is not always the leader in that moment. The one who speaks clearly during resuscitation is leading. The one who structures tasks when the department is full is leading. The one who slows the room when anxiety rises is leading. Emergency leadership is behavior. It is presence. Slide 5. Pillar 1. Composure. The first pillar is composure. Your nervous system sets the tone of the room. Imagine a 52-year-old presenting with sudden collapse and hypotension. Monitors alarm. Movement accelerates. Voices rise. If the leader becomes visibly stressed, the team amplifies that stress. But if the leader pauses for one steady breath and says calmly, "You manage airway, you secure access, I will reassess circulation," the room stabilizes. Composure is contagious. So is panic. Slide 6. Pillar 2. Clarity. The second pillar is clarity. In emergency medicine, confusion increases cognitive load. Consider a 34-year-old major trauma arriving at the same time as a 78-year-old in septic shock. Competing priorities create mental noise. Leadership means short, structured instruction. Trauma team to bed 1. Sepsis protocol in bed 3. Update me in 2 minutes. Clear direction reduces chaos. Unclear direction multiplies it. Slide 7. Pillar 3. Decisiveness. The third pillar is decisiveness. In emergency care, waiting for perfect information can cost time we do not have. A 60-year-old presents with acute stroke symptoms within a narrow treatment window. Investigations are pending. Data is incomplete. Leadership means making the best decision with available information and adjusting as new data emerges. Decisiveness is not recklessness. It is informed courage under uncertainty. Slide 8. Pillar 4. Emotional containment. The fourth pillar is emotional containment. A 19-year-old presents after self-harm. Relatives are distressed. Staff feel emotionally affected. Or a 3-year-old arrives with seizures. Parents crying. Team tense. The leader does not dismiss emotion. The leader absorbs it. We are here. We will manage this. You are safe. You do not eliminate fear, you prevent it from spreading. Slide 9. Micro-leadership moments. Leadership is not only visible in resuscitation, it appears in small moments. When a 45-year-old has waited 6 hours and frustration rises. When a junior hesitates before prescribing. When overcrowding creates fatigue across the team. In these moments, your tone, posture, and words shape the culture of the shift. Emergency leadership is built in seconds. Slide 10. Conclusion. An emergency leader does not control how busy the department is. They control their response to it. They are steady when others rush, clear when others are confused, decisive when uncertainty rises, compassionate when strain increases. Leadership in emergency medicine is about regulating the room. And although these lessons come from the emergency department, they are not limited to medicine. The ability to stay composed under pressure, to make decisions with limited information, and to regulate emotion in chaotic situations applies to daily life as well. Emergency mindset is not just a clinical skill, it is a life skill. Every shift gives us the opportunity to lead, not with ego, but with steadiness. Emergency leadership begins with mastering yourself. Subscribe to the channel for more emergency department mindset videos and share this with someone on your team who needs it on their next shift.